Howdy folks, welcome back to Trump and Media. Go ahead and strap in, this is going to be another long one. I'm going to be talking a lot about Sweden, and we're going to be looking at some really interesting numbers here at the end, which you're going to want to stick around for. To start, I would like to show how the media is depicting Sweden. Sweden has given us the greatest gift we could ever ask for. They've given us a control group of a country that did not impose any lockdowns. They immediately tried to go for herd immunity. So of course, everyone on the planet doesn't like that. So just to give you an idea, if you go to Google, especially Google, I think most of us are aware that Google is doing some really interesting things with their search algorithms lately. But you type this in, and what do we got here? USA Today. Sweden hoped herd immunity would curb COVID-19. Don't do what we did. It's not working. Look at that right there in the title. Grim coronavirus death toll projected in Sweden after lax approach to pandemic. And Sweden's coronavirus approach doesn't pay off for the economy. Yeah, well, not every media outlet agrees with these people. But anyways, if you look through these headlines, they all pretty much say the same thing. Turn away, Sweden bad. Don't look, Sweden bad. So we're going to look at a couple of these. To start with, we're going to look at this one. Now, from what I can tell, most of the pictures that I've seen, they show outdoor eating and dining. I haven't seen anything indoor. I think they do have some indoor stuff, but all the pictures they've shown have been outdoor. So we'll get to exactly what they did. Nothing was imposed. People kind of just did stuff on their own. Here, Sweden had one of the most relaxed COVID-19 lockdowns in the world. There's growing evidence that it helped it weather the 2020's economic storm better than anywhere else. Okay, this was just released or published, and this was a positive article, which is why I wanted to cover this one. So, you saw the other one where it said it didn't help the economy. Well, this one says it did, and this is Business Insider, not Bloomberg. So let's see what this has to say. Throughout the coronavirus pandemic, Sweden has drawn international attention for its unorthodox approach to managing the virus's spread. Okay, first of all, the approach was not unorthodox if you've actually studied epidemiology. It's just unorthodox because everywhere else took an unorthodox approach to this coronavirus. Unlike most European countries, Sweden didn't impose strict lockdown measures. Now it's reaping the rewards, economically speaking at least. A report from Capital Economics, published on Tuesday, found that the Swedish economy was the least harmed in Europe, describing it as the best of a bad bunch. Though Sweden is not immune to the pandemic's economic impact, it was the only major economy to grow in the first quarter of the year. Throughout the coronavirus pandemic, Sweden has drawn international attention for its unorthodox approach to managing the virus's spread. I'll repeat again, it is not unorthodox if you've studied epidemiology. The Nordic state didn't impose strict lockdown measures, instead asking citizens to stay home if they were sick and to practice social distancing in public. I'm going to go ahead and repeat here. This is calling it unorthodox. Never in the history of ever did we ever quarantine the healthy. That has never been an approach in the history of recorded history. Ever. I liked how Crowder put it. Did you ever hear of non-leper pits or something like that? I forget. It was really funny at the time. But this is the first time in history that an approach has been taken to a virus to quarantine the healthy. The Nordic state didn't impose strict lockdown measures, instead asking citizens to stay home if they were sick and to practice social distancing in public. Bars, restaurants, and shops stayed open even when cases peaked in the country. Its relaxed coronavirus strategy, relying on personal responsibility and willful obedience, has been both praised and criticized. And while the jury is still out on the effectiveness of the country's public health approach, there is growing evidence that, economically speaking, the loose rules seem to have worked. It says, but the consequences of COVID-19 will persist. The activity across Nordic economies is likely to remain below pre-virus levels for the rest of the year, Capital Economics said. Capital Economics predicted that while economic output, the total value of goods and services produced in Denmark and Norway, would fall by about 3% this year, Sweden would see an even smaller contraction. Here are the short descriptions of the state Nordic economies in the Capital Economics Report. They call Sweden the best of a bad bunch in Europe. Norway, they say, is bouncing back, but energy shakeout to constrain growth. Denmark, they say, quick lockdown exit helps to limit the slump. So that's kind of a short positive article on the economic impact of their lack of a lockdown. Here you can see a graph showing the contraction or degradation of their GDP growth for all these other European countries, and the US is on there as well. Now we're going to go, the reason why I'm covering Sweden is because, or all these articles, is because not anyone is giving a complete picture of everything that's been going on there. Almost every article you come across is just very biased without much detail. Here's a more recent article comparing the US to Sweden, even though this really isn't accurate at all. It says the US is the accidental Sweden, which could make the fall catastrophic for COVID-19. With the COVID-19 pandemic rampaging across the US in April and 20 million people filing for unemployment in that month alone, libertarians thought there was a better way. The Heritage Foundation praised Sweden for preserving economic freedom. The Cato Institute said Sweden's response to COVID-19 may prove to be the superior from a public health perspective. In early May, Senator Rand Paul said at a committee hearing in the U.S. ought to look at the Swedish approach. The Swedish approach was to largely allow businesses to remain open, and at first it seemed to work with a death count nowhere near what it was in countries such as Italy, Spain, and the UK, which it still isn't. But even as Sweden was being hailed as a model, its cases were steadily rising and its death rate now exceeds that of the US. Not by a lot. Sweden also did not seem to stave off the economic damage it was aiming to avoid. That is not necessarily true. A lot of articles say this with no evidence to back that up. I mean, we just went over an article saying the exact opposite. Sweden's COVID-19 strategy adopted in March emerged from the country's top epidemiologists and other leaders. Oh, you know what? I'm going to look at, of course, that's linked to a New York Times article, okay? Their basis for this comment right here is a New York Times article. That's all you got to know there. Sweden's COVID-19 strategy adopted in March emerged from the country's top epidemiologists and other leaders' evaluation of what little science about transmission there was at the time, factoring in economic considerations and making a considered, albeit controversial, decision to stop well short of the full shutdown that other countries in Western Europe adopted. I'm going to go ahead and add that I myself have a little bit of education in this area, or I should say I've had some formal education dealing with human physiology, and about 15 years ago, I used to research a lot of things just on my own, and one of those things was epidemiology. And so when this all first started, I mean, I had a kind of an idea of where it was going to go because I'd done my homework. So to me, herd immunity made the most sense from the get-go, and I also didn't believe the numbers they were saying because they didn't make any damn sense. You know, I remember all the outbreaks in the past that they've tried to fearmonger like crazy. They've done it every time, and it never ends up being even close to as bad as they say it's going to be. One of my favorites was the Ebola epidemic, and I'll never forget how they were saying, oh, Ebola, it's going to be really bad. You had people saying that, 2 million people were going to die. I think the grand total was like 3,000, like singular 3,000. And it was very odd because the outbreak was in Africa. You had some reports coming out of Africa, which were really hard to find, where they were completely ignoring it. They thought it was a hoax. And the only reported cases on the planet were in the U.S. Now, does it make sense that there would be an outbreak of something like Ebola in Africa, and then the only place that it was supposedly spreading was in, you know, a couple sporadic areas in the U.S. and like nowhere else on the planet. Like it just didn't make any sense at all. I mean, most people in the U.S. especially, they're really, you know, they only know what happens in the United States. But you know, see if you can find a map of all the airlines and stuff that are traveling all over the world all the time. You know, people don't just come to the U.S. They travel all over the place. But so, you know, to me, again, the herd immunity really made a lot of sense. But anyways, let me keep going here. In early summer, parts of the U.S. began following a very similar approach, but one it had stumbled into, not chosen based on science. Now, the next few weeks will show the consequences of being the accidental Sweden. In some ways, you could say we're doing Sweden, but unintentionally, and crucially, without the guardrails that kept the country's case count from exploding, says physician David Rubin, director of policy lab at Children's Hospital of Philadelphia, whose COVID-19 model shows the epidemic resurging through early August almost everywhere in the U.S. but New England. Okay, we're going to go over some stuff later that, yeah, this is why not all doctors deserve the term doctor. Like, this guy obviously didn't do his homework. I got some information that I'm going to go over later on the other 4 human coronaviruses that, you know, if he was even taking those into account, that doesn't make any sense at all. I'm not sure why he's saying that we're accidentally like Sweden. Maybe because we opened back up or something, but there's really no comparison to be made. Like they never closed down, and I just don't get it. Like he doesn't even explain what he means by that. In addition to places like Arizona, Texas, and Florida that have been hammered since June, the latest run of the CHOP model, CHOP, identifies Las Vegas, Los Angeles, a bunch of other cities, is poised for widespread transmission. And there are early signs that the virus is moving up busy travel routes. Well, of course. I mean, it's been transmitting this entire time. But, I mean, cases are going to go up. The fact of the matter is that it's very unlikely that deaths are going to go up by much. And there's something interesting to be noticed in the deaths, which I'll get to later, too. I'm going to skip over some of this. Sweden never imposed a total shutdown of non-essential businesses. It closed universities. It did keep grade schools open, though, the entire time, which is interesting because, you know, people keep wondering if we should keep schools open. They had schools open the whole time, and out of all the deaths in their country, which I'll get to this later too, only one person under the age of 20 died of COVID in the entire country. So I thought that was interesting to note. It closed universities, banned gatherings of more than 50 people, including sports events, and discouraged domestic travel. So I guess they don't have sporting events. Most bars, restaurants, schools, salons. I know a lot of women would have been happy if we kept our salons open. And stores were allowed to remain open with largely voluntary social distancing. If Spain and Italy got hit by okay, whatever. Most of its citizens, however, didn't jump. Okay, this says most of the citizens stayed at home and everything, even though there's no way to prove that. All the pictures you see, there's plenty of people outside and going around. I also saw an interview with a guy from Sweden that said, you know, his life has been largely unaffected. He goes out to bars and stuff. I'm hopefully going to be doing an interview with one of my friends that lives in Sweden on my next video to get more of a personal perspective of that. Sweden also issued its distancing recommendations early. Imposing less restrictive policies right away can be more effective at slowing transmission, preventing cases, than stricter measures later in an outbreak. In contrast, the Swedes had done everything they were allowed to do, especially since face coverings were never required nationally, such as shop and socialize at the same levels they had pre-pandemic, it would likely have led to runaway infection, Hassan said. But Sweden is a place with a very strong... Okay, this is where he says that everybody stayed at home, but that's not necessarily the case that I've seen from people that live there. Oh, I like this part here. Because factors that kept Sweden's numbers from being even more dire are largely absent in much of the U.S., there is growing concern that this country will blow past Sweden's death rate and exceed its case rate even further. there's really no evidence of that. Our deaths are falling, so I don't know how. Well, the death rate's going to keep going up, and that's the other thing too that I'm going to get to here in a minute is that this is seasonal, and the season's over. And when the season's over, that means that you start a new season, and so you will start tabulating new death rates. So if we just kept tabulating the death rate, it would just continue to go up forever. So it's a little ridiculous to do that, which I'll get to in a minute, and that's going to present an interesting picture. I mean, it would be like, what if if we didn't have flu seasons and we didn't split them up by seasons? You could say, 2 million people died in the last few years from the flu, or there was 500 million flu cases in the last 10 years or something like that. Like, that doesn't make any sense because you have to split it up into seasons. But I guarantee you they're going to do that. I guarantee you they're going to do that. They're just going to keep on adding to the number, and that death rate's just going to keep going up because they never stop it, which is the dumbest thing in the world. But I guarantee you they're going to do that so that they can scare you into giving up more of your rights. This talks about some of the states in the South reopening, so they're really hating on the South because we're reopening. I say we because I live in the South. Oh, I love this. Call it individualism, cultural libertarianism, atomism, selfishness, lack of social trust, suspicion of authority, the weak columnist Damon Linker wrote. It amounts to a refusal on the part of lots of Americans to think in terms of what's best for the community, of the common or public good. Each of us thinks we know what's best for ourselves. We resent being told what to do. Yeah, just go ahead and put words into everybody's mouth. This guy's a moron. Now, we're going to go back in time a little bit here and see what this looked like early on. This goes into more detail from the health minister, I think. As you can see in this picture, I don't think anyone's eating inside this restaurant. They're eating outside, but they're pretty close together. Okay, the Swedish model trades more disease for less economic damage. And this is another wonderful headline. While there is some incentive to the economy, less economic damage, I guess, from herd immunity. Herd immunity is just the proper approach from a health perspective. But they keep, I saw a lot of reports like this in the beginning, how they made it sound like Sweden was basically saying, well, we don't mind if more people die just as long as our economy doesn't suffer. That is not what the health minister is in charge of. The health minister is in charge of public health. And the whole point of letting the virus run its course and allowing for herd immunity is to prevent greater outbreaks later on. That's the whole point, and they don't really ever talk about that. I think he mentions that in here, though. On May 8th, Swedish state epidemiologist Anders Tegnell gave an interview via Zoom from a parked car. The hot pink cord, okay, I don't care about his earbuds. It says, before this year, it would have been hard to scare up 10 journalists to listen to him or any other epidemiologist, but Tegnell drew 450 reporters and other curious people from 60 countries. An additional 10,000 have since listened to the recording of the, I don't know how to pronounce that, colloquy with Joyce Barn. Okay. The next few weeks or months will tell whether Tegnell's strategy is brilliant or, as many experts outside of Sweden believe, benighted. Does anyone know what that means? Bad? The Swedish government was deferred to him and his fellow scientists to set the rules for a relaxed semi-shutdown of Swedish society in response to the COVID-19 pandemic. Gatherings of more than 50 people are banned, but Swedes have continued eating in restaurants, shopping, going to work, getting haircuts, and sending children under 16 to school. Few Swedes wearing masks. Bloomberg Economics expects the economy to shrink 5.6% in 2020 versus 8.1% for the nations of the Eurozone. Okay, I've seen a lot of people report on this. They're basically saying like, well, we're going to try and reduce the shrinkage of the economy by 3% or less than 3%. What is that, 2.5%? 2.5%, and we don't mind if more people die. Well, sorry to hurt your feelings, but they actually did a better job with the economy, and it had nothing to do with that to begin with. The downside to the strategy is that the virus has claimed a far higher percentage of lives in Sweden than its neighbors that locked down. As of May 10th, Sweden had about, it talks about Denmark and Norway. Many of Sweden's deaths were in nursing homes. I think 50% of Sweden's deaths were in nursing home. Wait till you see the ages on that, which I'll get to later on. Now, they've said many times that they admitted that they didn't protect the people that were highest at risk. They didn't protect the nursing homes. That's why they lost a lot of people in the nursing homes. I believe that part is true. I don't necessarily believe that was an accident, which I'll get to later. But let's see, after the spike, once they got into May, Minister Stefan Löfven now says his government plans to spend about $220 million to protect senior citizens. Okay, that was maybe after the first week of May that they did that. Techno argues that the scales will tip the better the job countries did suppressing the first wave of infection, the greater their risk of a second wave. Okay, this is where he talks about that. So he says suppressing the first wave is not necessarily a good thing because that increases the risk for a second wave. He estimates that roughly 25% of Swedes have been exposed. The more people who are immune, the harder it is for the virus to spread. Full herd immunity in a homogeneous population comes at 60% or so. This right here is this is smart. Okay, this is actually smart. And, there's a reason why no one else is doing this. I mean, you can go ahead and put your tinfoil hat on or whatever, but, there's a lot of there's so many people that have vested interests in everything that's going on. So, I mean, you just got to understand that. It's just true. It's just a fact. Everything that's happening around us, people have vested interest in. You see people, I mean, how many drug companies are clamoring to make a vaccine? Why are they clamoring to make a vaccine? Not to save you, I promise. If that was the case, we'd have a cure for cancer by now. They're clamoring to make a vaccine because they will make billions upon billions upon billions of dollars selling it to everybody. Same thing with the therapeutics and stuff like that, and I want to do another video on hydroxychloroquine. That's a whole nother thing, but just keep in mind that hydroxychloroquine is like $1 a pill or less, and these new therapeutics that they just made are millions of dollars. I just heard the hospital where I live, they got like a 3-month supply of that one that starts with an R, I can't remember, and so they got a 3-month supply, and then after that, it is $1 million for every month, just for this small hospital here. Remdesivir, is that what it is? So, I mean, put that into perspective. These, you got drug companies posing or, standing to make millions of dollars. They do not want some 70-year-old drug that costs 50 cents a pill to take the place of that. These people are in position to make a ton of money. That's what they do. All right, it's a very risky bet. The standard strategy pioneered by China and replicated by the likes of South Korea and New Zealand is to subject the population to extreme but temporary social distancing measures to drive down the number of active infections to the point where they can be kept to a minimum through testing, tracing, and quarantine. Okay, I've got some stats on South Korea and New Zealand. Oh, oops. Actually, New Zealand, I don't have them in the stats later, but theirs are pretty much identical to Australia, so you can see that later on. See, the suppression phase devastates the economy, and the subsequent stamping out brush fires phase requires ceaseless effort. In Seoul, one 29-year-old man inadvertently infected dozens of people in a single evening when he visited a number of recently reopened bars and nightclubs. Okay, this talks about the standard strategy, like sort of what we're doing, trying to slow the spread. They do more rigorous contact tracing in some of these other countries, but it's a little ridiculous in my opinion. The siren song of Sweden is that none of that is necessary. Okay, this is what he's saying. Trust your citizens to be prudent about social distancing and stay home if they're sick. Keep the number of cases low enough so hospitals aren't overwhelmed. Isolate the most vulnerable while allowing, although they didn't do that in the beginning, while allowing the disease to spread gradually through the rest of the population, most of whom will get only mildly ill. That will increase resilience. Such a strategy can be tolerated for years, in case it's how long it takes for a vaccine and antiviral drugs to be developed. I mean, that sounds like a much more sane approach than everyone lock yourselves into a cave should come the day that we actually have a vaccine. It might be 10 years from now, but don't worry. Just get comfortable in your cave, you know. Polls of Swedes show strong support for Tegnell's approach. One man got a tattoo of the epidemiologist on his arm. That's pretty badass, actually. Sweden does not seem to be much worse off in terms of the spread of the virus in countries with stricter measures, says the owner of a clothing boutique outside Stockholm. This has been a tough spring for us Swedes, but it is acceptable. Okay, it's got some comments from citizens here. If you want to put out a forest fire, it's a lot better to start doing it when only a few square meters are burning than when thousands of hectares are in flames, a professor of clinical virology said in Stockholm. Now, the high death toll in nursing homes also sullied Sweden's record. The government was slow to restrict visits to them. Authorities in Stockholm emailed one on March 11th saying it had no legal right to bar visitors. Despite the new spending for senior citizens, the fact remains that nursing home workers live in the community and are liable to bring infections into their workplaces if the virus is on the loose. See, they probably should have taken a better approach there. Even if the relaxed attitude is right for Sweden, it might not be right for others. The country has a generally disease-resistant population. I don't even understand what that means. And the world's lowest rate of obesity. That definitely helps. A condition that makes COVID-19 more deadly. Okay, this is definitely true. Obesity is considered an underlying condition. I've said that before. And the fact of the matter is, a lot of Americans suffer from high obesity. Close to half of households in Stockholm are single person, allowing for easier social distancing. And, you know, I was one of those people that under Obamacare, like even when I don't have health insurance, but even when I did have health insurance, I never used it. In fact, one of the companies I worked for, I traded in my health insurance for what was it? It was like some kind of health savings account or something where I got the money back because I take care of myself. And under Obama, I didn't have health insurance and I got charged a fee every year because I was healthy. I can't even tell you how infuriated I was about that. You know, there has to be some personal accountability for taking care of yourself. You know, if people want to sit on the couch all day and eat Cheetos and weigh 300 pounds, and then when they got to go to the doctor, I should not have to pay for that. Okay, now maybe, you know, that qualifies me as a libertarian, but I'm sorry. Like, there has to be personal accountability. And hopefully that personal accountability will, you know, get people to, you know, start eating properly and exercising. But the fact of the matter is, if you haven't been eating properly and exercising, you're going to be more susceptible to this virus, or in other things also. Tegnell isn't budging. If you look at the curve over time, it is quite clear now that it is slowly but surely decreasing. He told the Swedish newspaper, as it gets warmer, it means that you're more out in the environment where the virus can thrive and spread as quickly. And that's why we have seasons, which I'm going to get to that here soon. Okay, I'll just try and skip through this one really quick. This is Forbes. Of course, this is going to be negative. A warning from Sweden's coronavirus response. And this was on June 4th. Sweden now has among the highest per capita death rates. You know, it says it was lax in its implementation of protective measures. Refusing to implement broad stay-at-home orders for residents or to enforce recommendations to wear masks. They recommended all of this, they just didn't mandate it. Early on, my Swedish friends seemed proud of their exceptionalism. They sent many of their children to school. without many of the protections that are both in place and under consideration in many other countries. By the way, they were fine. They were fine. Wait till we get to the ages of the deaths. These people were absolutely fine. It's like they're hating on Sweden. You know, it's like, gosh, Sweden, you actually sent your kids to school. And we won't mention the fact that nothing happened. But outside the country, many voiced their praise of Sweden's common sense approach, which they wagered would be less economically destructive than stricter measures and would not lead to any greater number of deaths. For the most part, that is true. Just wait till we get to the data. Oh, they were wrong. Even the chief. Oh, yeah. Okay, this is good. They were wrong. Actually, they weren't. Even the chief architect of the Swedish anti-coronavirus plan is able to admit it. In an interview translated by Reuters, Sweden chief epidemiologist told Swedish radio that the country clearly could have done better in fighting the virus and that there was quite obviously a potential for improvement in what we have done. Okay, wait till we get to what he actually said. In particular, he said Sweden should have started testing earlier and more extensively, and they should have done more to protect their older adults. In Sweden, Sweden's long-term care centers, where more than half of all Sweden's coronavirus deaths have occurred. Okay, that's what some of what he said, but the context is a little lost there. And this says, of course, repeats, for all the loss Swedes have endured, there has been no associated economic gain. That's absolutely not true, which is what many claimed was the saving grace of the Swedish approach. That's not true. Like the guy took this approach because of the health reasons. The added bonus was, the economy. And everyone keeps trying to say that they were trying to put the economy first. The person making this, I mean, you know how like everyone right now is like Trump says all the time, you know, how Fauci is not, Fauci only looks at stuff from a health perspective. And he doesn't understand that, while he thinks that locking everything down might be good to help the virus, he doesn't take into consideration all the collateral damage, even from a health perspective, actually. But also from an economic standpoint and everything else. This guy is exactly like Fauci. He just chose a different approach specifically for health reasons. But they keep trying to paint it like he gave a crap about the economy. He is not an economist. His position has nothing to do with the economy. And they have a socialized healthcare system over there. Like there's no incentive for him to make a decision for public health because of how it affects the national economy. And this goes on to just kind of talk bad about that. I want to skip to this part because this is the actual interview that they were talking about. This is Reuters. This is the guy here, the epidemiologist, Anders Tegnell. Let me get to what he said here. We continue to believe the strategy is good, but then there are always improvements one can make, especially if you look back over time. It would be strange if you gave a different answer to that question. Basically, he's saying hindsight's 20/20. And then he mentioned about the testing. Sweden has a lower mortality rate than European countries such as Britain, Spain, and Italy, which they still do. And all those countries enforce stringent lockdowns. If we were to run into the same disease, knowing exactly what we know about it today, I think we would end up doing something in between what Sweden did and what the rest of the world has done. Mainly, I think, right here, it says at the same time, we have to admit that when it comes to elderly care and the spread of infection, that has not worked. Too many old people have died here. So, he basically says that they could have tried to protect the more high-risk people, obviously. Okay, now I want to take a look at the seasonal stuff. Okay, the statistics I'm going to bring up, this is classifying this as a season, which I think it should be done. I showed this graph in the last video I made. Where is it? As you can see here, these are the flu seasons. For us, this has dropped all the way down to the baseline of the flu season. So this is seasonal. Also, here is an article written in April talking about the other 4 human coronaviruses and how they are all seasonal. As epidemiologists work to track the novel coronavirus, that's the one we're dealing with, and predict its next moves, a new study from the University of Michigan found that other human coronaviruses behave in a highly seasonal, highly predictable manner. The investigators of the study, which was published in the Journal of Infectious Diseases, examined the 7 coronaviruses known to infect humans, focusing on the 4 that cause severe respiratory infections. All 4 of those were found to be highly seasonal. While the findings don't have direct bearing on whether or not the novel SARS-CoV-2 is likewise affected by the changing of the seasons, the investigators say they hope their study will provide valuable context. Now, I think that the fact that this affects the respiratory system is why the season matters. Even though the seasonal coronaviruses found in Michigan are related to SARS-CoV-2, we do not know whether the virus will behave like the seasonal coronaviruses. Now, this was back in April. As you can see from the chart that I showed, it appears to follow the seasons according to that chart. And let me skip down here. Combined over the 8 years, the number of identifications for each virus increased in December, peaked in January, February, and began to decrease in March. And just like you can see from that graph, what's week 15? Or is it? That would be February, March. That's the end of March. So this did the same thing, as you can see here. Now, the reason why this spike, like I noted in the last video, why it's a little bit farther in the year is because of the time that that virus entered into our society. But it's following the exact same trend as all these other ones. So now I want to look at some of this. Okay, here is the ages, and this is the total deaths. These are kind of a bad representation. I made some other charts, but I just wanted to know that both of these are updated as of July 17. But there is actually 10 more deaths on this chart for some reason. I don't know why. I can't even tell you which category they put them in. But as you notice here, there's only 1 death in the entire country of someone under the age of 20. Now, I didn't look them up, but I guarantee you there was probably 1, 2, 3, or 4 premorbidities involved in that. There almost always is, or there always is, I guess, from what I've found, especially in somebody that young. Probably the same thing in these people here. But as you can see, the vast majority of these people were very, very old. And just to give you an idea of that, here is a chart showing the ages. These are all over 90. These are all 80 to 89, 70 to 79. So as you can see, the vast, vast majority of these people were either in nursing homes or of nursing home age. And I think that's important to note. And again, I'll just go over what I know to be the differences between the regular flu or pneumonia and this particular virus. From everything that I've read, and I've been researching this for months now, the coronavirus doesn't affect kids like at all, and whereas the flu virus does, the coronavirus appears to be a little more dangerous if you have underlying conditions, especially respiratory related. Also, it appears to be dangerous if you have an autoimmune disease. I think one of the main reasons for that is because a lot of people who have autoimmune disease take medication, immunosuppressive medications, to dampen their immune system, and so their immune system is basically their immune system is already compromised. I would also imagine that a weak immune system probably isn't a good combination. You know, a lot of times when you have these underlying conditions, you aren't taking care of yourself, you have a weakened immune system. That's why one of the things that you can do to prevent from being affected by this virus is to boost your immune system. Another thing I want to look at is this right here. Now, if you ever wanted to compare the US deaths with the Swedish deaths, this is it right here. Now, it's hard to compare them directly because the populations are so different. So what I did was I compared the per capita deaths. So in this way, you're able to directly overlay the timeline. So basically, it's like, well, if we took the Swedish approach and didn't have a lockdown, the chart might look something like this. Now, there's other factors. Like I was saying before, you know, Sweden has a socialized healthcare system. Now, this might just be the conspiracy theorist in me or just being really cynical, but I mean, let's face it, you know, people in government, I mean, or you know what, I'll give an example. I applied to work at Target once, and I took the personality test, and there was a question in there I'll never forget. And the question was, how many politicians do you think are corrupt? And there were options, and the options were 20%, 40%, 60%, and 80%. There was no option for 0%. Okay, so you know, I just think that goes to show that I don't think anyone on the planet thinks that, you know, all politicians are benevolent. I mean, you know, according to that test, at least 20% got to be corrupt, right? So, anyways, the reason why I say that is because in a socialist healthcare system, this is just a fact. All these people that are of this age and with pre-existing conditions and everything, these are all a massive drain on their healthcare system. I mean, I hate to say it, but it is a fact. You know, it could just be an accident, you know, with them being so dumb when it came to protecting their old people. But if you were a real cynic, you could say they did it on purpose. Now, I don't know, but that's just something to keep in mind. Now, getting back to here, the main thing I want to point out here is that, you know, the whole reason we went on lockdown was to, you know, flatten the curve or whatever. And I think whoever came up with that term, flatten the curve, should be drug out into the street and shot. I also think whoever came up with the term uptick should be drug out into the street and shot. What the hell is an uptick? You know, it's either an increase or a decrease. And we've got plenty of words in the English language, descriptors, to put before that word to describe an increase. Like, there is no such thing as an uptick. I hate that word. So anyways, if you look at this graph, they're pretty much identical, other than the fact that this is a little higher. If you look at the trends on these lines, they're exactly the same. So in my opinion, this kind of proves to the point that the lockdown really didn't do anything as far as the spread of the virus or the prevention of deaths. Now, I mean, you could argue that, you know, maybe this little area in here, you know, we saved those people, but I mean, I think that's really reaching. I think that's a bad hypothesis to make, but I think a proper hypothesis to make is that these trends are the same, which in my opinion means that this lockdown was worthless, and we really haven't been under a lockdown if you think about it. I mean, there's a lot of things we haven't been doing, but everybody's going to the grocery store. Masks don't work despite what everyone says. This virus is highly contagious, especially through the air. You know, social distancing really is pointless. You know, even the president said that, you know, when he talked about social distancing, he says, you know, six feet, that makes sense, but really, you know, it makes sense to be farther away. Now, that actually makes sense because 6 feet really isn't going to do anything for you. And so, you know, we've been mixing and mingling for the whole time. We just haven't got to do any of the fun stuff, basically. And then that's not even getting into the riots, but we all know about, or excuse me, the protests. So you got hundreds, thousands of people, out in the middle of the street, rolling on top of each other. Right, this next piece of data is where it gets really, really interesting. Now, what I want you to notice here is these are per capita deaths, and I've got the top 15 states per capita, the lowest 15 states, and I've got some countries mixed in there too, and I put Sweden in there. This is mainly to look at where Sweden is. And like I was saying before, I believe we're at the end of the season. I do not think it's proper at all to keep just adding COVID deaths onto the statistics. I think they need to start a new season, for their second wave or whatever they want to call it. In my opinion, there's enough evidence to show that this is a seasonal virus. And if you keep that in mind, here is Sweden right here at 54.2. This is for every 100,000 people. Now, if you look at this is no mandated lockdowns, no nothing, at 54.2. And look at all of the states and countries above it. And if you want to look at the list over here, it's right here. So you have Michigan, Pennsylvania, Italy, Maryland, Spain, Louisiana, United Kingdom, Belgium, Rhode Island, District of Columbia, New York, Connecticut, Massachusetts, New Jersey, and New York City. None of these people, or every single entity here had mandated lockdowns, all these restrictions, closed down the economies. And yet, for some reason, they had significantly higher per capita death rates. And you'll see, these are the highest countries on the list. So here's Belgium. That's not counting San Marino and some other little country that's like the size of a nickel. I can't remember what it is. But basically, the real countries are on here. So you had all of these states. These states have significantly higher per capita death rates than any of the countries on the planet. Okay? And these are significantly bringing up all the national numbers for the U.S. And I still have the U.S. in here. Well, I have the median U.S., which is right here. And the average, actually. The average U.S. is right here at 42.4. which is a little bit below Sweden, which, is why they say that, we did a much better job than Sweden because we're a little bit lower right there. But if you look at the median for the U.S., and this is where it gets really interesting, the median is right here at 18.7. And I included the last 2 years of the high and low estimates for the flu numbers. And, the other thing I wanted to point out here was when people compare this to the flu, they say that there is a 0.1%, is that right? 0.1% death to case rate. Now, what they don't tell you is that is based on estimates. When they say 35 million people had the flu last year, those are estimates. They did not test 35 million people for the flu. And when they come up with the death rates per case in this country and every other country, those are actual physical tests. And if you'll remember, anytime they've done a study where they try to estimate how many cases are actually out in the population, which is a lot more than what we have on record, they're immediately erased from the internet. If y'all remember those two doctors from California, back in, I forget what month that was, March or something. So keep that in mind, which is why I'm focusing here on the end of a season. We can now look at the per capita rates for the season, and it'll give us a much better idea, a much better comparison to something like the flu. And so here you have the high estimates and the low estimates. They usually list the actual numbers somewhere in the middle. But for the 2017-2018, these were the high estimates. This is a per capita, 29.1. As you can see, the median for the U.S. is significantly less than that. It's also right about exactly the same as the high estimates for last year. And then these are the low estimates over here. So, and then a bunch of states had much lower than that. So basically, this is the flu right here. And you've got a bunch of states and countries down here, and you got a bunch of states and countries over here. But the median is right here next to the flu. I mean, to me, this is undeniable right here, is that we are dealing with something that basically has a death rate almost exactly equivalent with the flu, despite what they tell us. If they were actually able to test every single person in the United States, then we might actually be able to get a per case percentage on that, but it's never going to happen. And especially never going to happen if they're not allowed to do estimates, because that's exactly how they come up with that flu death rate. The other thing I want to point out here is Brazil. There is some interesting stuff happening in Brazil. It almost looks like it's the exact equivalent of what's happening here, except worse. The president over there, the media everywhere just completely bashes him because I guess he likes Trump, and he's Trump's buddy or something, so everybody hates him. And they've got some issues with hydroxychloroquine over there, just like here. He promoted hydroxychloroquine, so everybody else is saying it sucks. And but what he did is he left everything up to the local governors, just like here. Everybody wants to blame Trump for everything, but it's like, well, look at all these states down here that are really low. Does he get credit for those? Is he responsible for these really low death rates down here at the bottom? Or is he only responsible for the high ones? There is such a deviation from the most deaths to the least deaths. Why is Trump being blamed for this stuff over here? It doesn't make any sense. And the same thing happened in Brazil. And there's just a lot of shady stuff going on over there. But I noticed something. I was reading an article, and I went and looked at the comments section. And there was one comment from a guy that lived in Brazil. And he said that the governors that oppose the president there are inflating the numbers like crazy. Like he was saying in one area, it was like 10 times the death rates in another area. And it is because they get funding from the government for COVID cases. And I think that's really important to note, because when you have situations in some of these other countries, like Scandinavia that people talk about all the time, there aren't any financial incentives to inflate the case numbers. But here in less socialized countries, there are incentives. Financial incentives. So to me, it's like you have the same problems going on in both countries for the exact same reasons. Money. But just take a look at some of these countries. Again, here's the flu numbers. Look what we have down here. South Korea, Japan, India, which I find really interesting down here, Poland, Israel. Go look at the Israeli news. They're losing their minds over there protesting Netanyahu and all this other stuff. I've seen some fear-mongering news articles about Israel and the coronavirus. Look how low their numbers are. They're way less than the flu. So, I mean, they're not even dealing with flu numbers over there, and you got people going nuts. Turkey. Okay, I know that was a long one. I think that's going to about cover it for today. Hopefully in my next video, I'm going to either cover hydroxychloroquine or I might have the interview with my friend from Sweden first, so we'll see. I hope you guys learned something, and stay away from the mainstream media and do your own homework. Y'all have a good one.